Greetings. So when last we met, I was griping about this appointment I had with the registered nurse that I don't think went all that well. And I griped about some other stuff. Well, this is kind of an update, and in order to not let this go about a half hour long, because nobody wants to watch that, I'm going to try to hit on certain points. And near the end, I'm going to tell a brief story and how everything kind of lines up. Just stick with me. So anyway, I had mentioned that I was going to be having an appointment with both a educator and a nutritionist. So what happens is that I go in, have the first appointment with the educator, and we're talking about this stuff, and I tell her how the last appointment went and how I was angry about it and how I didn't feel like after all these years I was being treated properly. I didn't get to have my say. So we started to have this conversation about how everything was going. And we talked about the Trulicity, and we talked about the Lantus, and we talked about, pretty much everything. And she was trying to tell me how things have kind of changed over the years regarding medication, which is fine. But what I told her is that I've got people who are making choices for me without telling me what these things are supposed to be. I said the doctor really didn't tell me anything. The nurse, the registered nurse, didn't tell me really anything. And I need to know. I don't want someone to not tell me what things are going to do. That's why I got off the Trulicity, because no one had told me that it was going to make me lose weight, just like the Ozempic. So anyway, we had this meeting, and it was going along pretty good. So I have to say that was wonderful. That went well. Then I went to talk to the nutritionist. And it was interesting in the fact that she was a very demure lady. It was, it took a while. It was almost like I had to warm her up for the conversation. And she had someone else in there who was a third-year medical student, but she was sitting in on the meeting, which was really interesting. But there you go. So then we start talking, and I'm not sure if she educated me or if I educated her, but I will say that I made her laugh a lot, because I guess that even though I think that I eat normally, I guess she didn't think so. It was one of those kind of things where she's trying to say, well, for breakfast you should have this and this and this, and I'm like, that's too much stuff. I don't eat that kind of stuff in the morning. I eat one little thing. And then we talked about lunch and how when I'm working, I don't usually eat lunch because I don't pass a place where I can have anything. So we talked about that and how I'm telling myself that I need to start bringing something to eat in the car because I don't have anywhere to stop most of the time. And she's trying to change me to say, well, you could eat this and this, but I don't eat that stuff. I mean, I can see where that's kind of an issue with them, how they understand. You're trying to tell someone we want to try to have a mix of protein and carbs and everything like that to keep your glucose level, term I use, because I don't like the term blood glucose. Oh, Lord, hate that term. Anyway, so we're having this conversation, and it's going along, really well. I now have a better understanding about the protein thing, and so I'm going to work on that. I told her I was going to be buying these rotisserie chickens at the grocery store because that's basically 4 meals from one. Sometimes it's even 5. But it gets me real close to that 80. Sometimes it puts me over the 80 with that and other stuff. 80 grams of protein at my weight is supposed to be around 80. And I don't get there all the time. But trying to hit that, I was going over a lot of times, which I guess is no big deal in going over. It's just so strange trying to figure out how to, at least get close every day and still fit in my dessert. Yes, I'm having my dessert every single night. Anyway, there's that. Now, I'm going to come back to her in a little bit. Then I start getting other phone calls. The registered nurse who I'd had that appointment with, 2 weeks later, she calls me. She's never called. Nobody has ever called me to have a conversation with me on the phone. But we had a conversation for about 20 minutes. And I was nice, because I'm always nice. And she's asking me questions about stuff that we actually went over, but I guess because she was irritated or whatever, or maybe she was being rushed because she had other patients to take care of. So she's asking me these questions that I knew I had answered, and then she answered for once some of the questions that I had. And it was a weird conversation. I didn't quite understand some of it at the time, but I didn't ask. I just, we had this conversation going, I let it go. And she said, well, we're going to be changing from the Novolin to the Huma something. I don't know if it's called Humalin or Humalog. I don't have any idea. But I said to her, okay, you can change it, whatever. It's still a regular insulin. It's nothing that's going to try to make me lose weight, right? She said, no, it's not going to do that. I said, okay, I don't mind that. However, I just bought the Novolin over the weekend. So it was like 3 days earlier. I'd gone to the store. I got my Novolin. I brought it home. I've been taking it ever since. I said, I paid for it. It was only $4.32, but still I paid for it. I said, I'm going to finish this up before I move to something else. She says, okay, that makes sense. I don't know if it made sense or not, but this is her version of trying to be nicer. So there we go. So we had that conversation. And then about some days later, 3 days later or so, I get a call from some company that I didn't know, but I guess they work with the Joslin Center and both trying to get certain, I'll say, medication or medical systems to you. And they also deal with the insurance companies. In my case, I turned 65. So they were looking at the Medicare and secondary insurance and, what I had going and all this other kind of stuff. And they were based in Florida. So I'm living in New York. I didn't understand any of this kind of stuff. But we had this conversation. She mentioned the same thing about we're going to be, they're going to be changing your other medication. I said, yeah, I know I had that conversation with the registered nurse, but I told her I'd already bought the Novolin. So I'm going to finish that because I paid for it. That was my money. It came out of my pocket. I didn't tell her how much. Didn't care. So anyway, I figure, okay, we've got this thing going. We talked about the Dexcom G7, which I've had problems getting. So let's talk about this. First, we're going to talk about the Novolin, because when I got a call from the store saying, okay, we've got the Novolin, it's ready. I said, okay, how much is that going to be? She says, $84. I said, say what? She says, $84. I said, no, that's not going to work. I'm not paying $84 for that, and it was 4 boxes of the Novolin. So she did some research on her own. I'm there on the phone with her, and she says, well, it seems that if we have to do it that way, we have to charge you $84. I said, okay, what if I don't want 4 boxes? What if I only wanted 2? So she looks it up, and it comes to $5. I said, wait, what? How did we go from $84 to $5? She said, because the Joslin Center basically gives you a prescription for something to last 100 days. The insurance company has a rule that basically says if it's more than 90 days, everything goes up higher. I said, get out of here. I said, so basically, if I'd gone for the 3 boxes, I still would have had a really low price? She says, yeah. I said, let's just go with the 2 because they want to change me to something else. I don't know why. So I've got that going. And then we're talking about the Dexcom G7. I haven't had that in, at this point now, 3 weeks. And I didn't know why. And of course, this now came up as a conversation, and I figured out because the Joslin Center requested 4. which is more than 90 days. Actually, it's not more than 90 days. But they requested, for the insurance company wanted to know why this was a medical thing, which sounds really stupid. They want me to do this thing. The Johnson Center wants me to hook up with them. I still haven't decided if I'm going to do that yet because I haven't had a Dexcom G7 in a while. So anyway, I'm talking to this lady, and we finally get to all the information. Supposedly something's going to be coming out. I should be receiving something soon. It's been 2 weeks. I got an email on Thursday saying we're shipping this thing out, which basically tells me, okay, I won't be getting it at the store. I won't be getting it at the Johnson Center. It's coming through the mail. That's interesting. I've never had medication show up to, through there. Anyway, so now I'm curious. Okay, what is this deal with the Novolin? What am I missing here? Why are they moving me to something else? I'm going to look it up. And it turns out that by the end of the year, nobody is going to be making Novolin anymore. It's considered an old medication, even though it's from 2000. I mean, some of the other things that I've seen seem to come out around that same time. Actually, I guess Novolin, in a different version, came out in like the 1940s or something like that. So it's actually older, even though they've made modifications, from it. And it made me wonder, what's Walmart going to do? Because it was back in 2012 when I started the Novolin. Although I didn't know that's what that was. I really didn't pay attention to what it was called. I just know that my doctor at the time said, if that other medication that you were on is going to cost you $450 to get, go to Walmart, buy this other stuff, $24.95. And so I'd basically been using that forever until the Johnson Center said, well, we can give you some of these things for a while. I said, okay, fine. And at least now I learned something. No one told me this. I had to do the research to find out, and that's okay. But here's the thing. Now we're going back to the nutritionist, because everything goes around. So I'm talking to her about different things, and we're getting close to wrapping stuff up. And I said, when we were talking about the vegetables, I had this problem with high potassium. And so back around, 2012 or so, no, I got that part wrong. The potassium issue, actually it was 2012. That's right, it was 2012. The potassium issue was the fact that I ended up with a high potassium. And I was told, okay, we can't have you doing anything with potassium because you only have two choices. One, you reduce it, take over time, or you have an operation. Mitchell wasn't having no operation. So this is how that goes. And then I'm talking with the doctor in the office this one time. And they had started to switch over to a new computer system called Epic. Now, Epic is a big name in healthcare these days. A ton of hospitals all across the country are using it. I didn't know them at that time. I started to know a little bit more about them 2 years later when I was consulting in Memphis. But, so they've got, this new thing here. And this doctor of mine, she wasn't young, and they didn't really train her. They didn't really train her how to use it. I was kind of savvy at computers. I don't know if I'm still as savvy as I used to be, but I was pretty good at stuff. And so I was in that appointment for 2.5 hours with her because I said, I'm going to try to help you with this computer system. I didn't know anything about Epic, but I knew something about computers. So it took me about, I'll say 2 hours since we started off with me just being the patient. And I helped her to figure out how to at least put certain information into the computer so that she could get on with the rest of her day. And, she thanked me a lot for it. That's okay, fine. I usually like the doctors. Usually, that is. So I'm talking to the nutritionist, and she's trying to look up this time period where I had problem with high potassium. And supposedly, when they'd gone over to a new computer system, They were supposed to move everything, back up all the records to it, but they didn't. So she couldn't find the thing when my potassium was high enough that it was recommended I stop eating it, but they did see one part in there. So basically they wiped out 4 years of certain lab tests. But there was one thing with the potassium where it was borderline too high, but still the rest of it. And so she was saying, yeah, 2012, I don't know what they were doing. I said, well, I was in there and I was with Dr. Moles, M-O-L-Z, so I'm not really sure how you pronounce it. I said I was in there with Dr. Moles and I showed her how to work on the computer. It was rough. It was a system I didn't know, but I figured things out and I sat there with her. And she appreciated it. And the nutritionist looks at me and she says, that was you? And I said, what? She said, Dr. Moles, she talked about that all the time, how one of her patients stayed with her and taught her how to put information into the computer system because no one really showed her how to do it. They gave her this quick thing and then they left her alone. And she talked about you all the time, but she didn't know your name, which I can understand. And I'm like, wow, I'm a legend in someone's mind. I thought that was interesting. I enjoyed that. That one got me leaving the Jocelyn Center with a smile on my face. And that doesn't happen often. So anyhow, that's what I've got. It seems like I've jumbled this a lot, but you know what? It is what it is. I hope some folks at least made it to the last 2 minutes of this thing. Maybe you learn something. Maybe you don't. Maybe you laugh. At least I hope some people see this and realize that if you're having difficulties with physicians or with the caregivers, stand up for your rights. Stand up for yourself because it's supposed to be about the patient. Y'all just understand that. My name is Mitch Mitchell. Whew, what a weird tale. I hope y'all have a wonderful day.